The scapula, or the shoulder blade, is the bridge between the arm and the neck. If the bridge is unstable or poorly positioned, the neck muscles must hold the shoulders up, and the shoulder muscles must work harder to move the arm. So why talk about our shoulder blades? It is a part of the body that contributes to a lot of shoulder pain or neck pain. And it is something that we see in younger people and more commonly. And especially one of the contributing factors is the time that we spend on with technology, spend time on our phones, and we don't look at our postures. So the shoulder blade is the foundation on which shoulder and neck muscles work. Most of the shoulder and neck muscles attach to the shoulder blade, and therefore any abnormal position or dysfunction can contribute to neck or shoulder pain. The shoulder blade is suspended on the ribcage and must move in a very coordinated way during arm movement. This coordinated movement is called the scapulohumeral rhythm. Any arm movement, for instance lifting your arm above your head, the correct movement of the shoulder blade will ensure that the acromion clears the rotary cuff. The head of the humerus, which is the upper arm, does not migrate upwards and thereby cause impingement. It prevents compression of soft tissue, and it prevents rotary cuff and bicep tendon injuries. The shoulder blade's influence on the neck, several of the neck muscles attach to the shoulder blade, and this contributes to the stability and the posture of the neck. The muscles that plays a role here is the upper trapezius, the levator scapulae, and the rhomboids. If these muscles have to work overtime to support the shoulder girdle, it can lead to neck pain or stiffness or tightness, headaches, and severe pain between the shoulder blades. So as our screen time increases, so does our posture problems. Poor posture that leads to severe neck problems and an increase in neck surgery, especially in younger people. So what are the problems that we can have with the shoulder blade? So the first one is something that previously we only saw in older people, and that is very rounded shoulders or a forward shoulder position. It just means that the shoulder blade is protracted. This is associated with tightness of the chest muscle. So the chest muscle will shorten and pull the shoulder forward. It's also associated with weakness and poor timing of the muscles in the upper back. So as the shoulders move forward, the muscles in the upper back becomes tight and they become weak. This will cause tension in the neck and the upper shoulder muscles, pain in the front of the shoulder, and pain when reaching for something or even during computer work. Our second problem that we see is if the shoulder blade is too depressed and rotated. This is caused by an overactive levator scapulae and rhomboids, and the upper and lower trapezius is then underactive. This is caused by long periods of carrying, sitting, and guarding. It will cause pain between the edge of the shoulder blade and the spine. So a lot of patients will say, oh, just behind my shoulder blade, I've got severe pain. It also causes neck stiffness, and it is difficult then to maintain your arm above your head. So a lot of people will see that if they, for instance, want to change the light bulb, they can't maintain their arms above their head. The third problem is if the shoulder blade is elevated, this will lift the shoulder up and bring it closer to the earlobes. And many people will say, I carry my tension in my neck, but the cause of that dominant trapezius might be your shoulder blade and its positioning. This is caused by upper trapezius that is overactive and dominant. Overactive trapezius cause burning or fatigue in the upper trapezius, neck pain, headaches, and shoulder pain if the arm is lifted above 90 degrees. So, in order to correct that, it is quite important that when you go to see a professional, that they must look at not only your neck or your shoulder, but at the positioning and the rhythm of the shoulder blade, and that should be addressed and corrected during rehabilitation.